My name is Lamnatu Adam. I work at Somtaba as the Executive Director. As an organization, Somtaba prides itself for working for underserved communities. And for us, issues regarding women's health, especially with their access to health facilities, is of paramount to us. As women's rights organization, we understand that not all women have the same challenges. For example, if you look at urban-rural differences and how women, especially expectant women, access health, is of great concern to us. And that is why this year's International Women's Day, we celebrate with the rest of the world and to ask for women's rights, to ask for justice, to ask for access, especially for health. This year's theme on rights, access, and justice resonates with the work that we do, especially when women and underserved populations are not able to access health. Then justice is denied them. This year's theme, because we live in a certain kind of social structure, there's the need for us to enhance our patient charter explanation with communities, especially with rural communities, so that they understand what their rights are in accessing health services. We also need to also push for the disability inclusion, especially with regard to accessing health. Take, for example, if a deaf person walks into a consulting room, how does the person get to explain to the doctor to appreciate what is wrong with her or him? And then also, we seriously need to advocate for more funding towards health. And so this year, the attention should be looked at in this direction. How do we ensure that health is accessible to all, irrespective of disability or not? How do we ensure that our community's social norms, does not further disadvantage women in accessing health? And how do we push for government to expand funding towards accessing health? I think as civil society organizations, we need to collaborate effectively with government sector. For example, Somtaba has taken the initiative of holding what we call a breakfast meeting with the Ghana Health Service to work with other civil society organizations in pushing for nutrition, at least for women. And so we have to find innovative ways to work with government so that we have a kind of a coordinated agenda that we need to push. I think in the last few years, we have experienced some dwindling funding. And I'm afraid that in the next few years, we're going to suffer the effect of it, especially as major donors to some of the work that civil society do. And of course, even to government, some major donors have pulled out. One of such is the USAID. And that can have a devastating effect on accessing health and improving maternal and child health outcomes. Women and girls are living without full legal protection. Women's rights means nothing if we are unable to defend them. So therefore, when justice fails, women pay the price. We therefore need a collective action towards ensuring health access to all.